Pregnancy reshapes the skin through hormonal, immune, and vascular shifts. In this video, we uncover why dermatoses occur and how to identify and manage them safely and effectively. Pubertic urticarial papules and plaques of pregnancy is a common benign dermatosis seen in late pregnancy, especially during the third trimester, and in first-time mothers. It typically begins with the abdominal stretch marks and spread to the thigh, buttock, and arms, while usually sparing the face, palms, and soles. Patients present with intensely itchy red papules that coalesce into urticarial plaques, causing significant discomfort and sleep disturbance. The exact cause is unclear, but rapid abdominal distension, connective tissue damage, and immune changes are believed to contribute. Importantly, poops poses no risk to the fetus and usually resolve spontaneously after delivery. Management focuses on symptom relief with emollient, topical corticosteroid, and oral antihistamines. Education and reassurance are essential, as the condition can be distressing despite its harmless nature. Prurigo of pregnancy is a benign pregnancy-associated dermatosis characterized by intensely itchy, discrete papules that appear on the tensor surfaces of the limbs and trunk. It can arise at any time during pregnancy, most commonly in the second and third trimester. The lesions are small, erythematous, and often excoriated due to persistent scratching, which may lead to crusting and post-inflammatory hyperpigmentation. Unlike other pregnancy dermatoses, prurigo does not begin in the abdominal tract and is not urticarial in nature. The exact cause is unclear, but is thought to be related to immune and hormonal changes during pregnancy. Importantly, this condition poses no risk to the fetus. Management focuses on relieving pruritus with emollient topical corticosteroid and oral antihistamine along with patient reassurance and skincare guidance. Pubertic folliculitis of pregnancy is a rare, benign dermatosis that typically appears in the second and third trimester. It presents as a multiple small, itchy follicular papules and pustules on the trunk, especially in the chest, abdomen, and back. The lesions resemble acne or bacterial folliculitis, but occur without comedones and are not caused by infection. The exact pathogenesis is unclear, though hormonal and immune changes during pregnancy are suspected to play a role. Pruritus can be bothersome, but condition poses no risk to the mother or fetus and usually resolve spontaneously after delivery. Management is mainly symptomatic, including gentle skincare, emollient or mild topical corticosteroid if needed. Reassurance is important as the appearance can be alarming despite its benign cause. Intrahepatic cholestasis of pregnancy is a pregnancy-specific liver disorder that usually occurs in the third trimester. It is characterized by intense generalized itching without primary skin lesions, often worse at night and prominent on the palms and soles. The condition results from impaired bile flow due to hormonal and genetic factors, leading to accumulation of bile acids in the bloodstream. While the mother may only experience severe pruritus, ICP is clinically significant because elevated bile acids are associated with fatal risk, including preterm birth and stillbirth. Diagnosis is confirmed by elevated serum bile acids and liver enzymes, Management includes close obstetric monitoring and treatment with ursodeoxycholic acid to reduce bile acid level and relieve symptoms. Early recognition is essential to predict fatal outcomes. Striae gravidarum, commonly known as trademark of pregnancy, are very frequent skin changes that develop due to rapid abdominal enlargement and hormonal influences. They usually appear during the second and third trimester on the abdomen, breast, thigh, and buttock. Early lesions are pink to reddish purple and slightly raised, reflecting dermal tearing and inflammation. Over time, they fade into pale, atrophic silvery lines after delivery. The development of striae is linked to collagen and elastin disruption under effect of mechanical stretching and hormonal changes, particularly increased corticosteroid. Although harmless and painless, they can be cosmetic concern for many women. Prevention is difficult, but regular moisturization, controlled weight gain, and gentle skincare may help reduce their severity. Ligne nigra is a common physiological pigmentation seen during pregnancy, presenting as a dark vertical line running from the pupil area to the umbilicus and sometimes up to the sternum. It results from increased melanocyte-stimulating hormone, estrogen and progesterone, which enhance melanin production in the skin. This hyperpigmentation is more noticeable in women with darker skin tones and usually become prominent during the second trimester. Ligne nigra is completely harmless and do not associate with any disease or fatal risk. After delivery, the line gradually fades over several months as hormone levels return to normal. No treatment is required, but sun protection may help prevent further darkening. Reassurance is important as this change is a normal part of pregnancy. During pregnancy, many women notice darkening of the areola, axilla, and genital areas due to physiological hyperpigmentation. This change is driven by elevated levels of estrogen, progesterone, and melanocyte-stimulating hormone, which increase melanin production in hormonally sensitive skin regions. This pigmentation often becomes more pronounced in the second and third trimester and is more visible in women with darker skin tones. The process is completely normal and is not a sign of disease. This darkening may help prepare the body for breastfeeding, as the areola becomes more visible to the newborn. After delivery, the pigmentation usually fades gradually over several months. No treatment is required, but gentle skincare and sun protection can help prevent further darkening. Pyogenic granuloma, also known as lobular capillary hemangioma, is a benign vascular lesion that may develop during pregnancy due to hormonal and vascular changes. It appears as a small, rapidly growing red to reddish purple papule or nodule that bleeds easily with minor trauma. These lesions commonly occur on the face, finger, lips, or oral mucosa, especially the gums, where it is called pregnancy tumor. Despite its alarming appearance and tendency to bleed, pyogenic granuloma is non-cancerous and poses no risk to the fetus. Some lesions regress spontaneously after delivery if bleeding is frequent, or the lesion is bothersome. Treatments such as cauterization, laser therapy, or surgical removal may consider. Ectopic eruption of pregnancy. AEP is the most common pregnancy-specific dermatosis encompassing eczematous and prurigo type lesions in women with a personal or family history of atopy. It often begins early in the first and second trimester, presenting with intensely itchy, dry, erythematous patches on the face, neck, flexures, and trunk, always scattered pruritic papules on the limbs, hormonal and immune shift toward a Th2 dominant profile are thought to trigger or worsen atopic inflammation. AEP is a benign, does not endanger the fetus, but pruritus can significantly affect sleep and quality of life. Management focuses on emollient, gentle skin care, topical corticosteroid, and oral antihistamine needed, along with reassurance and avoidance of irritant. Acne during pregnancy is a common condition driven by hormonal fluctuation, particularly increased androgen that stimulates sebaceous gland activity. It often appears in the first and second trimester, presenting with inflammatory papules, pustules, and sometimes nodules in the face, chest, and back. Increased sebum production, follicular plugging, and inflammation contribute to lesion formation. Unlike typical acne, treatment options in pregnancy must be carefully selected to ensure fetal safety. Many standard acne medications such as oral isotretinoin and certain topical retinoids are contraindicated. Self-management focuses on the gentle cleansing, non-comedogenic moisturizer, benzoyl peroxide, azelaic acid, and selected topical antibiotic. With proper care or reassurance, acne in pregnancy can be effectively controlled without harming the mother or baby. In particular, herpetiformis is a rare, severe form of pustular psoriasis that occurs during pregnancy, usually in the third trimester. It presents with bright red, erythematous plaques covered by sterile pustules, often starting in the flexural areas and spreading rapidly across the body. Patients may experience fever, malaise, nausea, and laboratory abnormalities such as hypocalcemia or leukocytosis. Despite its name, the condition is not related to infection or herpesvirus. In particular, herpetiformis can pose serious risk to both mother and fetus, including preterm labor and fetal distress, requiring urgent medical attention. Management often involves systemic corticosteroid and careful obstetric monitoring. Early recognition is essential as prompt treatment can significantly improve maternal and fetal outcomes.